Vaccine efficacy is not the reason behind the viral surges in certain Mid-East, South American and Asian countries, as much as the wanton public disregard for health protocols and physical distancing in such places. A vehement pushback, a high-ranking DOST official stands by against allegations of an ineffective Chinese vaccine brand used for immunization in these countries, as we hear more from PTV's Mark Fatalco.
Reports, COVID-19 cases are rising in countries where majority of people have received China's Sinopharm vaccine. These include the Seychelles, Mongolia, Chile, Uruguay, and Bahrain. But according to Dr. Jaime Montoya of DOST, the increase in cases could also be linked to COVID-19 variants which can reduce the efficacy of vaccines.
Ito rin po ay nakadepende rin sa pagsasagawa at pagsunod ng mga mamamayan natin sa minimum public health standards at yung pagkakaroon po ng mga variants na alam naman po natin na bagamat pwede pa rin pong ganito yung ating mga bakuna ay nakapabawas din po sa pagiging epektibo ng ating mga bakuna.
According to Dr. Ron Ginsulante, an infectious disease expert and a member of vaccine expert panel, COVID-19 surges could still occur as long as there are people who remain unvaccinated.
For us to really stop the pandemic, yung population, proportion of population na kailangan bakunahan, dapat 80 to 100%. Dahil if you have a vaccine na ang efficacy between 60 or 70, you need almost everyone in the population para sigurado ka walang transmission.
For its part, Malacanang said,
wag muna nating tanggapin po yung conclusion na nagkakaroon ng resurgence sa mga bansa na ginamit ang predominantly Chinese. Kasi pati po sa Inglaterra, nang ginamit nila AstraZeneca, halos lahat, halos 100% dahil doon po gawa ang AstraZeneca, and nagkaroon din po ng resurgence.
In early May, President Rodrigo Duterte was administered the first dose of the Sinopharm vaccine, which has a 79% efficacy rate. He is still waiting to receive his second dose, but last Monday, the FDA approved the application of the DOH for an emergency use authorization covering Sinopharm vaccines donated by China. Meanwhile, the DOH said the Vaccine Cluster Task Group is studying whether the government should procure Sinopharm vaccines.
Kung meron na po tayong mga basihan ng pagbibili katulad nito sa Sinopharm, ay ito po ay depend sa ating rekomendasyon ng ating mga task groups na namamahala sa pag-negotiate at pagbibili ng mga bakuna.
Mark Fatalco for The Nation.